Ladies and gentlemen, do you know how many people have been infected by COVID-19, since the first case has been reported? Anyone know? If you know, please raise your hands. Okay, if you don't worry, I'll be the one to inform you. So since the first case of COVID-19 has been infected, till nowadays, there are like 768 million people have been infected by it. Yes, 768 million people. And so you may wonder what is my topic for my presentation today, right? But first of all, let me, greet the judges and audience. So first of all, I would like to say hi and good morning to His Excellency Professor Nkabong, the Vice President of International University, our honorable judges, and also good morning, ladies and gentlemen. Once again, this is me, Thao Hai Lee Sinh Học, a Year 2 student from Faculty of Nursing. And yes, it's my great honor to be on this stage once again. So my topic is nursing care for COVID-19 patients. COVID-19 patient has brought challenges to the World Health System, which cause chaos to literally everyone and every country. And with the nurse in the front row to take care of the COVID-19 patients, so it's going to be hard and challenging. The nurse has to provide a compassionate and skilled care to the patient. So in this presentation, we will get to explore the nursing care for COVID-19 patient. First, we have symptom management. According to CDC, Center of Disease Control, the symptom of COVID-19 can vary from mild to severe, which includes sneezing, coughing, muscle ache, fatigue, yes, fever, diarrhea, or vomiting. Yes. So as a nurse, what is the role in order to have the patient to cure from COVID-19? Yes, the thing is the nurse have to provide the medication to help the patient to reduce the fever, to alleviate the pain according to the doctor prescription. And sometimes the nurse can also provide the oxygen therapy in order to help the patient to breathe better, because in some cases the patient have the lower level of oxygen, which is under 95% of oxygen. Second, we have infection control. COVID-19 can infect everyone, and especially when they're like a patient of COVID-19 sit here or stand here and speak. So their saliva, like the air that they breathe, can affect the other people, can affect the surrounding people as quick as they can. Yes. So what should we do? The solution is isolation. What is isolation? Isolation is the process of putting a patient which is infected by COVID-19 into a room, into a safe place from infected other people. And if we think out of the box, a lot of government during the 2020 and 2021, which is known as the severe of COVID-19 era, the government have to force themselves to lock down a region in order to stop the spreading COVID-19 to the other region as well. So this is called isolation. The other point is hand hygiene. In our daily life, most of our job is completed by hands. We use our hand to click on this, to click on that, to hold this and hold that, and literally do everything. And especially for the nurse, they have to use their hand to give an injection, to, feed the patient sometime. Yeah. So hand play an important role as the main spreader of COVID-19. So what should we do? We have to wash our hand regularly and correctly, from our finger to our palm and literally every part of our arm in order to make sure that the COVID-19 cannot land on our skin. Another solution is PPE, which is known as personal protective equipment. It is an equipment which is mostly used in the hospital, especially by the doctor and the nurse, because they are the one have the closest contact with COVID-19 patient. So yes, they are at the high risk of, getting infected. So they got to make sure that they have to cover up all of their part of the body from their head to their toes, literally everywhere, which led the COVID-19 virus to land on their skin, because COVID-19 is an airborne disease, so it can easily spread. So let's move on to the third part, which is about fresh air ventilation. What is fresh air ventilation? It's a process of, removing the bad air, the air with disease of COVID-19 to the outside, and also importing the fresh air into the room in order to make sure that the patient can breathe well, comfortably, and also it can reduce the risk of getting infected or infecting the other people. For example, like the nurse have to enter the room. So if the air is full of disease, is full of COVID-19, it means, they are at the high risk of getting infected. The risk of getting infected is accelerating, right? Yeah, so we have to make sure that we have to open the window to let the sunlight or the fresh air into the room. And yes, that's how it is. The next step is mask up. Mask can save lives. Every government, every country advertise, suggest, and sometimes even beg the patient in order to, wear the mask. And if we just look back at the data of many countries, the rate of COVID-19 is increasing drastically when nobody wearing the mask. However, after the mask policy of the government, we can notice that the COVID-19 rate has been increased drastically. Yes, so everyone please wear the mask when we are in the crowded place. The fifth point is psychological and emotional support for COVID-19 patients. Being positive for COVID-19, which, will make the patient feel like uncomfortable. They don't know what happened in the next second, in the next minute, in the next hour, or in the next day. All they know is the body is suffering with COVID-19, with the symptom that they have to lay in the bed and waiting. The nurse have to give them the nursing care. So what should we do as a nurse to give the emotional support? Yes, as a nurse, you have to provide the emotional support by saying, yes, you can do it. Everything's gonna be all right in the next day. Like with just a single word of the nurse who's taking off the COVID-19 patient, he or she will have the power to keep fighting back to against COVID-19 and cure quickly as possible. Another solution is we have to inspire or motivate the patient to, communicate with their loved one, like their family, their boyfriend, girlfriend, yes, anyone who have the closest contacts through virtual platform like Zoom or Messenger. So this can help them that they are not being left alone, even though they have COVID-19. Last but not least, we have discharge planning. Even though, I would like to say congratulations that finally the COVID-19 patient that under your care finally can go back to their home. However, they still have a really, really weak immune system. So what should we do? We have to tell them, we have to inform them to do the self-care. So self-care is the process of, telling them to eat correctly, like a lot of healthy food, the food with, which contain a lot of vitamin C, such as mango, orange, yes. And sometimes we also have to inform them to sleep well, because some people don't even know what is the amount of time that they have to sleep in order to have a healthy body. Yes. So now, ladies and gentlemen, in conclusion, COVID-19 nursing care is kind of challenging and complicated. It requires the nurse to giving support to the patient, have to do the prevention of the symptom, and yes, have to do the preventive of infection as well. So, ladies and gentlemen, please stay safe and let's